My name is Preacher Rose, and today I'm going to demonstrate about the Sitz Bath. So the first one to do is to review the medical order for the application of the Sitz Bath, including the frequency and the time for application. This is used to ensure to ensure the correct patient and correct procedure. So the equipment that we are needed are the waste receptacle, the bell, the drape, the clean gloves, the tubing with clamp, alcohol, the bag, the warm water, and a bulb. Perform a hand washing and put PPF indicated. This is used to prevent the spread of microorganisms. Good day, ma'am. My name is Preacher Rose. I'm your nursing student for today. What I want to do is identify the patient so that you will know that she is the correct patient. Ma'am, can you indicate your name?
I'm Shirley Ilden.
Okay, thank you, ma'am. Today, I'm going to perform the Sitz Bath. This Sitz Bath is used to clean and relieve pain and discomfort in the perineal area. Close all the curtains and doors to ensure the privacy of the patient. What to do is to put on gloves to prevent the spread of organism. Raise the cover of the commode, then place the bulb into the commode. Fill the container with the halfway full with the warm water to 37 to 46 degrees Celsius. So assuming that the container is already halfway full, it's used for promote relaxation and help with edema and circulation. Lift down the lid so that the patient will have comfortably in sitting position. Clamp tubing bag and fill the bag with warm water 37 to 46 degrees Celsius. And assuming that I will fill the bag with warm water. Then hang the bag above the shoulder height of the patient. This is the patient to transfer in the commode. And ma'am, okay. Now ma'am, I will assist you to transfer in the commode. 1, 2, 3. Please sit down.
Thank you. Okay.
Insert the tubing into the infusion port. If the tubing is placed before the patient sits, the patient may trip over the tubing. What I want to do is slowly unclamp the tubing and allow the bath to fill. The filling is to ensure that the tissue are submerged in the water. Clamp the tubing once the container is already full. The patient to open the clamp if the water is cool, because cool water may produce a hypothermia. Okay, you open the clamp if the water is cool already. So instruct the patient to call and tap the bell if she feels dizziness or lightheaded. Patient may be dizzy or lightheaded due to the vasodilation, so the bell should be within the reach. Ma'am, if you feel dizziness or lightheaded or any problems, you can tap the bell. Okay. So remove the gloves and perform hand hygiene so that we will prevent the spread of microorganisms. Patient is finished already about 15 to 20 minutes or the prescribed time. Assist the patient to stand and clean and gently clean the perineal area to dry. To stand while assessing and gently pat the perineal area to dry. Mom, please stand up. And I will gently tap your perineal area to dry. We're going to the bed and you will sit down or lie, depends on you what you like it. Put the call bell within the reach of the patient because patient may be feel dizzy or lightheaded due to the vasodilation. If you feel dizziness or lightheaded, you can tap that one to call me. Okay. Put on gloves and empty the container. It will prevent the spread of microorganisms. While emptying the container, you should base it on the policy agency of the container. Empty and disinfection of the container according to the agency policy. This is to ensure to prevent the spread of microorganisms. I'm assuming that I'm emptying and disinfecting the container. Remove gloves and additional PPE if used. And put in the container the gloves. I will remove gown, mask, and make sure that you will not touch the outside of the mask and put in the waste receptacle. Then perform hand hygiene so that you will prevent a transmission of microorganisms. The last one to do is to document so that it will use for the references of the patient.